Okay, there we go. I want to make sure everyone can see me. If you're having a problem seeing or hearing me, please let me know. But I'm going to get started. And I hope there are other nurses on this and ready for this piece of information that I have prepared for you. So tonight's talk is why nurses make great medical spa owners. Well, just to let you know, I guess I'm a little bit biased. I am a nurse. I'm actually a nurse practitioner. I guess I'm considered a veteran. I've been a nurse practitioner for 21 years now, but I'm also the owner of a medical spa. We actually have 2 locations, one right outside of DC in Maryland, and the other one is here where I'm at in Atlanta. But I find that nurses actually make great medical spa business owners. I think it's a great opportunity, especially now that there seems to be an exodus of nurses from hospitals for whatever reasons. I mean, some reasons are quite obvious. It's hard. Patient ratio is just getting, I guess, is getting kind of out of hand. But not only that, people are living longer. Our baby boomer population is growing at an exponential rate. I think daily is still about 10,000 Americans turn age 65. And with that said, because of advances in technology, people are living longer, which means they are sicker. So for nurses out here who have this great, wonderful dream to take care of people, and it seemed rosy until we get to the bedside and it's like, wait a minute, what is really going on here? I think that nursing provides a great living. However, the fact is most of our nurses, especially our millennial nurses, choose to have work-life balance. So you're seeing an exodus of nurses and a continual shortage in the hospital setting. So the question is, where are they going? We have a lot of nurses who are leaving the profession and just saying to themselves, frankly, you know what, I've had enough. But I'm here to say that there are some options for nurses out here. This is the best time for nurses to become their own bosses, or as we like to use this phrase, nursepreneurs. And there's so many options, right? You can be in an outpatient setting. I know nurses who are starting home healthcare businesses, who are starting staffing agencies, who are starting schools, who are authors. However, I personally feel that I'm not seeing enough nurses entering the world of medical aesthetics where I think that they would just make awesome medical spa owners. The fact that nurses love to teach is one great asset that a nurse has in a medical spa setting. I can't tell you how many times clients come in to see me and they'll tell me, like, they'll write off going to see their dermatologist or whatever. And it's no discredit to these other providers, but it's the same thing I'm hearing over and over again. They don't listen. They're not spending enough time. And I think the educated adult now want to pick more holistic types of ways of treating things versus just running to pharmacological options to treat skin problems. People now know that skin is actually a live organ, and anything you put on it is going to be in the bloodstream in a matter of minutes. Therefore, people want more natural approaches to skincare versus just the simple writing of a steroid or some other type of topical or some type of oral agent. And I think that's where nurses come in. From the time nurses are trained in nursing school, you're taught to consider what we called nursing considerations. And I've also taught on a university level. So we teach nurses to brainstorm other things that we can educate patients on to help them out. And I think that is a huge asset in the medical aesthetics field. I look at a person's home topical agents like I looked at prescription bottles in the past. So that's an asset that I know I'm bringing to the table because many of my clients tell me, no one's ever did that before. No one's ever looked at the ingredients of my products. No one's ever taught me that I should look for this or I should look for that. And I want to say that I owe that to great nursing training. So we're educators. That's for one. Number two, I believe nurses are great listeners. And a lot of times that's all people want in the medical aesthetics world is someone to listen to them. They've gone other places. They might not have liked what happened, but where can you fit in this equation to help this client? A huge asset that nurses bring. Matter of fact, at my other location in Maryland, I employ nurses because I just like what nurses bring to the table. So the same thing told to me at the Atlanta location is the same thing told to the nurse in the other location. Now, there's no disrespect to an esthetician or a cosmetologist. They know their profession and they know what they bring to the table. However, as a fellow nurse, I can say that nurses are very calculated. They know about charting. They know about strategic charting and being very careful in terms of documentation. So in the medical aesthetics world, that doesn't change. I still have to chart. I still have to make sure consents are done. I have to make sure consents are thorough. And that is a big piece, and that will prevent me from getting in lots of trouble. I think that the RN, or I have to say it, the nurse practitioner, brings bring assets like that to the table. So we got 2 pointers right there in favor of the nurse being the nurse boss. But most of all, nurses are determined more so than ever. I think women, period, because it is a female-dominated profession. Now, I think this is true for the male nurses as well. But however, I'm going to say this to those women nurses out there, because more than ever before, female entrepreneurship is like the fastest growing segment of entrepreneurs right now in this country. Why? I think because the roles are changing, right? Women are feeling more liberated. Women want to call their own shots. They want to be the boss of their own time. They want to control their own pockets. And our medical aesthetics field offers this to them. Here's the great opportunity. You already know beauty. Most women are already into how their skin look, how their face look, how their outward appearance look. So if you're already a caregiver and you already have great bedside mannerisms, I think it's easy to cross that over into talking to a client in the treatment room, touching the client. So having that skill set of touching someone and being personable is another asset, once again, that nurses bring to the table. So my question to everyone here on this webinar, because I like my webinars to be a little bit interactive, so please feel free to type something in if you have a question or you want to offer some other food for thought. But my question to you, because if you're on this webinar, you may be inquiring, like, is that something I would want to do? So the next question is, what's stopping you from doing it? You know, is it because lack of information? Or what will be the next step? Is it fear? So those are other obstacles that I think that as a nurse out there and you're wondering how to transition from whatever role setting you're in now into entrepreneurship and maybe starting your own medical aesthetics practices, I am here to tell you that I can help you. This is something I've been doing going on 2 years now. It's helping other nurses, nurse practitioners. Matter of fact, I can help any licensed professional. But I think because I'm a nurse practitioner, I attract nurses and nurse practitioners for whatever reasons. But I also teach medical estheticians, cosmetologists, any type of licensed professional enter this exciting field. The bottom line is this. Listen, as I spoke about the baby boomer population growing, the other fast segment that is growing fast are millennials. We have lots of millennials now in this country. And guess what? They're getting older. So what's considered a millennial? Anyone, they say, born between, I believe it's 1981 and 1996. And that segment is getting older. And guess what? They are well-versed and very well aware about anti-aging. And they are taking care of themselves in terms of skincare. So there's lots of growth in this industry. I think my fastest patient segment that's growing are male clients as well as the millennial clients. Millennials like to call it, I'm being preventative. So they're trying to do things before those lines and wrinkles and discolorations actually appear. Okay, so this industry is totally growing. There's much more room. You know, I can say that my practice is still growing. I'm not stagnant. And things are just getting more exciting because as more technology and more development come in the world of aesthetics, we're having more to offer our clients. Now, how do I help people get into business? There's two ways. I do live courses. I am a doctoral prepared nurse practitioner, have been for some years, have experience as a visiting professor for 2 different universities. So this is not something that I decided that I could just bring to the table. I want to say that I'm an experienced educator. I have one class that is online, but not like your online class if you're in your nurse practitioner or nursing school program. Much different. We're very interactive. Actually, I coach these people along every week on live web, or not even live webinars, but more live meetings. That class is called #MedSpaBusinessBuilder. And you can actually go visit AbrazaSkinInstitute.com, and there's information about the #MedSpaBusinessBuilder. In addition, I teach 3 other live courses monthly here at the Atlanta location, and we just wrapped up Botox and filler training today, as a matter of fact. So I'll type it in there so you can see, and it's called AbrazaSkinInstitute.com. And all class descriptions are there. If you are interested in jumping on that online program, it is self-paced. You move at your own pace. There's lectures like this. You actually see me talking. You're not just given things to do and you run off. I tell people of at least 45 days, you're in business. Once you start and you click and you join that course, guess what? You're in business. And just for you being on this short, quick webinar, I never like to take up too much of people's attention span or their time. You get to save. If you go to the #MedSpaBusinessBuilder course on AbrazaInstitute.com, it will take you to the page there on the online platform. And if you enter the code August, and look, I made this very easy, August 12th, you can save $200 if you join the course. And that's only going to be for about 72 hours. And that's just because you joined me this evening. Is there any questions, anything I can answer anyone? Please type it into the chat. You never thought of it as an option? Wow, interesting. Interesting. I think that people don't think it, and actually a lot of plastic surgical or cosmetic surgeons, they do hire nurses and nurse practitioners in their practice. What I'm oftentimes told by nurses who work in these practices is they felt like they weren't fairly paid. And I'm not sure what that means. Honestly, I really don't know what that means, because I'm not sure what's the competitive pay scale out here for nurses. But I think that's a disservice if a provider chooses, and don't get me wrong, I love estheticians, but if you want to think of someone who can explain the science of what's going on with that product in the skin, how it affects other organs or body systems, I believe that the nurse is prepared to do that, okay? I do teach Botox and Juvederm, yes. So one class I teach is called the All About Skin class. Because a lot of nurses or providers, let's just say, whether you're an esthetician or not, they may not know skin health on the level that I would as a nurse practitioner. So that class teaches some common ailments that are seen in the medical spa setting. So we discuss them. We discuss how do you treat them. A lot of people aren't educated about peels and what's out there in terms of peels. What's out there for anti-aging? What are the different ways to treat acne, okay? What are the ingredients in products that work? What are the ingredients in products that are dangerous? So all those things are discussed, and then the hands-on portion of that class is dermaplaning, as well as the hydrofacial, which is a treatment facial. Then on day 2, I teach microneedling and platelet-rich plasma. Now, if you're microneedling with platelet-rich plasma into the face, that's called a vampire facial. So I teach about the vampire facial, as well as using platelet-rich plasma for hair restoration. And the hands-on component of that class does consist of the safest way to do a vampire facial and hair restoration. Very important. I don't know if you've been in the news and seen recently, there was a transmission of HIV to someone doing the vampire facial, which is absolutely ridiculous because there's a safe way of doing things to prevent transmission of bloodborne pathogens. So that's discussed in the hands-on portion of that class. And then the third class is about fundamentals of botulinum toxin A. That's the generic name for your Botox, your Zoom-ins, your dye sports. So the drug of choice I use in that class is Botox and fillers. And we're talking about hyaluronic fillers. So, and the product used in that course is Juvederm. Both are Allergan products, okay? And then in the hands-on portion, of course, you administer filler and you administer Botox, but this is not advanced filler. I make that very clear. You can't get to injecting under eyes and doing hollows until you get the basics, and that's what I do in that class. Yes, it does. It talks about alopecia in terms of hair loss. Good question. So you have lifetime access to the online course. And what's so beautiful about the course is I'm always adding to it. Always. If something hits me like, you know what, I think they should know that, I'll go ahead and drop it in. And then every Monday, I do a live with it for our private group. And we have the private group on Facebook. And it's, do I do lip augmentation? Yes, I do. You mean lip fillers? I'm assuming that's what you mean, but yes, I do. I do lip fillers. And if the model is able to do it, or one of the other classmates are consentable to having their lips injected, it's done in the course. Not hard at all. Not hard at all. But we do discuss injection points where not to inject in terms of filler and in terms of Botox. Yes, that is discussed. And with the live course, you do take home pamphlets. So everything I present in my PowerPoint slides, you get a nice booklet to take home as well. And with the All About Skin class, you actually receive some of the products on the AbrazaSkinCare line. So I do have a skincare line. I do have a medical grade skincare line. And if you take that All About Skin class, you do leave with the essentials in the products. I always feel like, listen, if you're going to come into the aesthetics field, you have to at least have some pretty skin. Okay. Let's see. I'm just going to scroll back. I want to make sure I didn't miss anyone's question. Money and time. I totally get it. When I tell you, I totally get it. So let's talk about that. I can give you a little bit of insight on that. So of course I worked a full-time job, right? And then when I hit my biggest aha moment, like, okay, I'm done with this, I started to work on my business plan, just to let you know. And I started to think about how much money I'm going to need to make this next move. And, you know, when you're a new business owner, people are not throwing money at you in terms of the banks. You know, it's one of those things, and I think all entrepreneurs will agree with me. Actually, I just read a statistic recently for this one female group organization, and it said that 57% of female entrepreneurs borrowed their own money to start their business. And here's the thing. I didn't feel like I was gambling my money because I knew I was going to be successful. I knew I was ready to pour in. I told myself, if I could work this hard for somebody else, I can definitely work even harder for myself to make myself win. So I didn't feel like I threw my money away when I put it on my business. And I felt like, you know what, I'm gonna die one day, I understand that, but this money in my 401k, I've been saving it. And if I'm gonna put it to something, I'm gonna put it to something that makes sense. And for me, it was pouring and investing into my own business. So I hope that helps you. Another way in terms of money, I tell people is that when you develop this business mindset, then your spending habits have to change. You have to become a business thinker in terms of spending. Like I'm coming to you now with my scrubs on, you know, I taught today. So I invested, when I first started, I purchased $350 in scrubs, and I promise you I've been wearing those same scrubs for the past 2 years now. If I have to go somewhere, trust me, I have a lot of clothes in my closet. So it's not about the mall for me anymore. I changed my train of thought. Luxury car, I got rid of a luxury car. Yeah, I did. So everybody has a different story, how they want to do it. Some people don't want to give up certain things. Then you're just going to take a longer time to get to the money that you need. But and the question is, how bad do you really want it? So, and I think if you follow my YouTube channel, I'll talk about things like this. You know, I'm very transparent. I tell people I don't have a rich uncle, so I had to do it all myself. And I just changed my ways of thinking. Like, look at my nails. I was a woman who wore SNS and acrylics. It doesn't fit my budget being a businesswoman anymore. That is the sacrifice I have to do. So when people who know me see these levels of success coming for me, they understand the grit and the grind that I put myself through to make this business happen. So I'm not going to tell you that it was something easy. Okay, so I hope that helps you, because it is a business mindset. Yeah, I had to skip a Christmas of gift giving. Yeah, it's real. I tell people, so it's not easy. Everyone that's here that gets to a level what people consider to be successful, they all are going to share the same story of me, called grinding and changing how we do things. So I hope that helps. And then you could decide when you want to tell that full-time job sayonara. But what I did was I did continue to work PRN, and I continued teaching as a professor. So I still had a couple hustles going when I started mine. Okay. Anything else? Oh, what are your feelings about? You mean microblading? I'm thinking you mean microblading versus tattooing when it comes to brows. Yes, okay. And then I'll go to the next one. So microblading doesn't last long. You may get a year out of it, but you're still going to have pigment. So there's no such thing as it totally disappears. That's a farce. You're always going to have a little bit of pigment in the brow. But because, especially if you're oily, it's just going to be gone fast. Why? Because microblading doesn't go deep into the dermis, to the subcutaneous tissue, like machine does. When you're doing machine tattooing, those needles are going way past the dermis. So therefore, the ink lasts longer, okay? I personally like machine better. And right now, all my clients who got microblading done, they're coming back now for touch-ups, and they're all wanting the machine. They get it now. So I tell people the machine lasts longer. Now, if you go to a skilled tattoo machine artist, they know how to make hair strokes with the machine. You can make hair strokes with a machine. Now, that's how I was trained. Okay, I wasn't trained to just do a powder brow. So I hope that helps. And the thing about microblading is, when they drop those lines in, they spread a little, so they don't always look like, you know, crisp hair strokes like they do when you first get them dropped in, just to let you know that. But machine lasts longer. And do I teach business plan? Good question. So I don't exactly teach the business plan, but I give you the meat to the components of your business plan. I give you how to come up with these different pieces of your business plan, but I don't exactly sit there and do the business plan along with you. I hope that makes sense. So I define the different components of the business plan, and if you're looking for this piece or this piece, this is how we put it together. So I'm actually walking through the steps of your business plan. Yeah. And then with that class, I have a method I call the brand method. And so I talk about the business plan, your reason, okay, action. Okay, so we go through all of this. I talk about networking, and I talk about dynamic marketing. So that's the brand method. And that's the pattern of how that online course is followed. Why is this my passion? I'm often asked a question like that. So if you don't know this, I'll just go through it real quick. In 2008, December 7th, 2008, I was in a near fatal car crash. My background was always cardiology and emergency medicine. So I was in a near fatal car accident in the Virgin Islands, and I went partially ejected through the windshield, and subsequently I acquired lots of facial trauma to the left quadrant. Actually, it came from here all the way across. My nose basically came off of my face. So I had to have rhinoplasty on my nose, and I had to have skin taken from this eye to rebuild my left eye. Okay, so I have skin grafting here. I lost my whole left eyebrow. So totally gone, no hair, nothing, gone. Okay, so my brow was, that introduced me to permanent makeup. Back then, there wasn't any microblading. So I had my brows tattooed on. I had keloids all on my face. In addition, I fractured my left hip, my left femur, my left foot. So I was jacked. I was in a hospital for 3 weeks, multiple surgeries, blood transfusions. I was intubated, everything. But each time I was introduced to some part of my healing process, I started to restore my self-esteem. As you know, it was mentally tragic for me. And it started to come back. I started to feel better about myself each time. And I would tell each provider, whether it was my physical therapist, I was in physical therapy 3 days a week for 9 months. Whether it was the gal who tattooed my brow, whether it was when I went back and I had fractional laser, when microneedling came out, I had microneedling done to help with my keloids. I got introduced to the best skincare ever known to man. And that was the first time I spent $700 on skincare products. And I was like, this stuff better work. Okay. And I became a skincare junkie, and I became obsessed with getting my skin restored to the way it was. Okay. So each time, thank you so much, Lucia. Each time I had something done, I started to feel better. And I remember telling Julie Wynn, she's the lady who did my brow. She's in the Maryland area. I said, and I always cried tears of joy. Like, I should do what you're doing. Like, you're making people feel good. Like, I got to tell people what to do and they still don't do it. But people that come to you, they're going to do it because this is what they want. Just a different perspective to nursing, right? And she said, you should do it. You should do it. So I was in the same position as someone just said, oh, thanks, Sherry. I was in the same position that someone just said, where I was working full time. Where could I get this money? And I stayed in that position for many years, to the point where I got burned out, and I was a nasty person to work with. And a provider I worked with, a physician, said to me, you need to find your passion. And you need to run with it. Because at that point, I was developing programs in cardiology at a national position. You feel like you're the top of your game now. I was speaking at events for the American Association of Heart Failure Nurses. So you could say I arrived. I'm an expert now, right? But I wasn't happy with my career. And so the last straw was working with a semi-psychotic physician. Okay. And I said, there's no way I'm going to do this. I'm going for broke. So my house was already sold, got rid of the luxury vehicle. I just lined everything up what's the word? I reduced my monthly needs. And I said, because I'm going to work PRN and I'm going to teach and I'm going to get my med spa started. And that's just what I did. Unlike what I'm offering people, I paid a plastic surgeon $9,999 to spend 1 day with me to give me the ins and outs of this business. That's a lot of money, but that's how much I wanted it. I put it on my Chase card because I needed to know. I'm cardiology. I need to know, how does this work? I need the expert to teach me. And by teaching, one of my students said, hey, Dr. Welch, I noticed that you have a med spa and you teach me Botox fillers. And I said, when you graduate, I didn't want her to mess up my money. And so I said, I can't be halfway about teaching anything. So let me develop this course the correct way and give it to her better than when I took a class at a hotel conference room and we all 15, 20 of us in this one model. So I said, no, I'm not going to do that. I have to do it 5 times better. And that was the beginning of AbrazaSkinInstitute. It happened by accident, I tell people. And that's why I'm passionate about skincare. And because I'm so obsessed about skincare products and ingredients, I started looking at the products that I was using myself and was like, really, this isn't all good. This would be better if they did this, this, this. This will be more affordable. They should have just put this one and this one together in one bottle. And those are things I brought forth in the skincare line, AbrazaSkinCare. So that was a long answer, and I'm sorry, but that's why I'm passionate about what I'm doing. What is it about the skincare products? Safe ingredients. I try to be as safe as I can and still have something that can last on the shelf. So I think that's one thing that sticks out. Is safe for all skin types, all color skin, all ages. All right, so there's no parabens. We know now parabens are found in breast cancer tumors. No parabens in these products. There's no phthalates in these products. There's no, I can't think, but bad stuff. There's no sulfates in this product. So it's good stuff. And it works. Awesome peptides. So I love peptides. Yep. So I hope that helped. Let me go back. Somebody asked the passion. Someone, do I teach a business plan? I address that. Microneedling. Think I got it. So again, AbrazaSkinInstitute. I hope this was helpful to you. I hope someone out there is like, you know what? This is what I'm trying to do. I'm tired of this place. August 12th is the code. Save 200. Okay, that's save 200 when you go to the AbrazaSkinInstitute page and click on hashtag #MedSpa Business Builder. Let's be clear. Okay, but let's get it together. You know, I think it's a good, great group of providers in the course right now. I want to grow it. I want us to be more encouraging. What's even more great is when I can work with someone more hands-on. So this weekend, today, I just finished teaching hands-on to 2 beautiful, intelligent women who had already been in the online class. So it's so cool to meet people and not just that, but get to know them, and it feels personable. Like, these are my friends. These are now part of my tribe, I like to say. We're part of this Abraza tribe. What do you mean a good company to take? To take? A little clearer for me, Sherry, so I can help you out. Oh, you mean a good microneedling device? Is that what you mean? To get certified and equipment. Okay, so the word certified is funny in aesthetics because there's no such thing as being certified. You have to show proof according to your boards or wherever that you were properly trained. Okay, you have to show. I would never buy an MD pen. And you know, you and I know each other. I could talk to you on that. I'm sorry. I'm not trying to trash nobody's product, but I've had a bad experience. And that's just the truth. But that's me. So I'm not endorsing someone that did bad business with me. I'm just not. Absolutely not. Mm-mm. Mm-mm. But yeah, bad for me and my personal experience. I'm not knocking anyone else, but I just can't endorse someone that did bad business with me. Now, so it's up to you. So some companies, if you buy their pen, they'll train you. And I think that's awesome. That's cool. I use a Procell. That's what I like. I love Procell, hands down. Less traumatic on the skin. Those other pens, they drag. They leave track marks on the skin. And they have small surface area and they hurt like I don't know what. And you have to use lidocaine. I don't numb when I'm microneedle. I want PRP going into people's skin, not lidocaine. They're not lidocaine facials, they're PRP facials. So I'm the one who don't numb, and I have way better, nicer outcomes. I mean, you can look at my skin. I don't even have smile lines, and that's not filler. There's no Botox in my face right now. So I don't like them. They're way too traumatic. I get so many clients that come to me that will microneedles with these other devices like that, and they look like someone punched them in the head 5 times and they're all bruised up. Why? Because those devices are traumatic. They go way too deep, especially for Fitzpatrick 4 to 6, that hyperpigments. So I love the Procell because it just hammers into the skin. No drag of the needles, no drag. Wider surface area, so you're delivering faster because you want the procedure to be fast. Those little ones, you can be there forever, and then your client will hate you. It's like, that hurts so bad, oh my God. So I like the Procell, and they're made in America. That's something to say, right? Safe. Yes. Thank you, Lisa. So I love Procell. You need a connection with that, then you could just always message me. I'll help you out. I know someone. Matter of fact, I just gave it to some gals that I just trained about all of this stuff. I just gave them some information because they had some sale packages, just to let you know. Too bad you're not on the East Coast, Sherry, because I would tell you, you need to come on to Atlanta, let me train you in some good vampire facial, some hair restoration, and get you going, but you're far from your love. Good question about laser. So so I have laser treatments, right? However, I'm thinking it's going to be December or January. We're just going to invite a small group for laser training. There's a gentleman here in Atlanta that does awesome laser training. He's a guru, and he's going to come to AbrazaSkinInstitute, and we're going to do a small group. He has the booklets, everything. He'll get you going, teach you laser. Yeah, different modalities of a YAG, a 1064. And I know what I have, and I know what he's going to bring. So we're trying to have like 3 different laser machines for this training. So I'll be glad if you were able to sign up on the sign-on page. I'll definitely keep you posted for when that comes. And the reason why we're saying around December-ish is only December or maybe January, because we're running into holiday season already. And so why put up a course that a lot of people are not going to take? And the bottom line is, if you're ready to open your med spa, you don't need to have a laser to open up your door. You don't need to have heavy equipment like that right out the gate, unless you got it. You know, if you got it like that, then yeah, go ahead, rock on. But right now, that's what I'm going to do. So I'm going to try to offer the lasering more like every 3 months or so, rather than saying we do laser every month and there's 1 or 2 people in the course. Hope that answered the question. I know. But yeah, but I'm telling you, you would really like the Procell. Get one of them providers to come out to you and do a demo, and you feel it yourself, and you'll be like, sold. My clients leave and they can go red carpet ready with a Procell. And yes, you don't have to look beat up for it to be effective. You don't need to get to the subcutaneous and the capillaries. You do not have to look bloodified for it to work. Those needles just have to hit into the dermis. So that's a farce. Russian needle thread? No, I don't. So I'm a person who I want to look and wait and see more about those needle threads. But that's me. I want to wait and see. I've been hearing people say, oh, God, it's not as easy as you think. Oh, you remember when you look at YouTube, they did 5 takes and made it look good. So I want to wait and see what's going to be the outcome with that. So no, I'm not doing needle threads. I still, if someone has that much sag, I go ahead and I refer them to plastics. I have an awesome facial plastic surgeon that I like to refer people to. But yeah, I gotta see. I'm like, I'm not. And you know, I'm pretty fortunate where a lot of my clients, I get them good with some excellent, great medical grade skincare that they like, nah, I don't think I need any lift. I'm actually very happy. You know, a lot of people don't believe in the basics, which is skincare. Skincare is the basic. That's the foundation. So I don't even like doing a vampire facial on someone who's using oil of Olay. I'm like, really? You're using oil of Olay? Like, you should be on much better skincare. I mean, now we have Aqua Gold out here, so you could do the Botox facial on people. You could, my machine has Titan, which does radio frequency tightening. So there's so many other things. And now they got Skin Tight. The plastic surgeons got Skin Tight, where they're using radio frequency and heat, and they just put these wands under the skin, heat it up, you tightened. So, you know, you got to be careful with these other things. But no, I don't. But again, preference, you know. All right. Well, I hope that was helpful for everybody. I hope I was able to answer a lot of questions. I usually like to cut it at 30 minutes, and I'm at 41. So I think I overwhelcome my stay in your viewing. Listen, I do Motivational Monday every Monday pretty much because I just love giving the information. You know, as you can see, I'm very excited all the time. So you can follow me. I have a couple pages. The Dr. Natasha is very easy, and that is on my IG, and that is also on Facebook. You can follow me on there. I do my lives from Facebook on the Dr. Natasha, or you can follow us at AbrazaSkinStudio, and that's on Facebook and that's on IG. New page, okay, beat me, you know, I'm still getting with all of this social media stuff. But I just recently started the Abraza Skincare page. But let me tell you what's exciting. Every month I give away a product. We do a contest. So follow, please, Abraza Skincare. I need some followers on that page. But follow. And I'm about to do the drawing, the last drawing. My Instagram been acting up. So Abraza Skincare, AbrazaSkinStudio on Facebook and on IG, and the Dr. Natasha as well on Facebook and IG. Now, the thing is, there's something else. No, y'all don't want to follow my dog. You got better things to do. And I think that's it. And then you can go to, if you're ever interested in my skincare products, let me tell you how easy I do everything. You can go to AbrazaSkinCare.com. Very easy. Isn't that easy? You shared your email, you get an email update with all this stuff. That's the skincare. If you want to see my med spa website, then it's easy. You go to AbrazaSkinStudio.com. Same thing. I make it like very easy. Okay? And if the classes, I already told you, AbrazaSkinInstitute. And it's AbrazaSkinInstitute on Facebook too. Oh gosh. One day I'll learn to spell institute, I promise. I wish you guys could see me type back. You would crack up laughing. Okay? So they're all there. All right. Bye, everybody. Have a great evening. Thanks once again. Have a great evening, everybody. Bye.